This is my first time presenting with Neverplus. So just a little bit about me to start with. I am a women's health physiotherapist. I've been a physiotherapist for nearly 10 years now. I have a sports background, so I started in sports physiotherapy, and then I was working with elite athletes. I was working with the Parramatta Eels juniors side actually, and decided that I was becoming a little less passionate about what I was doing, so decided to restudy, get into women's health, and I have loved it ever since. I am also a clinical Pilates instructor as well. So I guess my background kind of makes me really, really passionate about keeping people moving throughout their pregnancy and moving throughout any kind of pelvic floor disorder that they may have. My personal training background, I've done a combination of CrossFit, Pilates, obviously with my background, and running. So yeah, it's nice to kind of have that background and try and keep people moving throughout their pregnancy, but also postpartum as well. All right, so today we're going to talk a little bit about kind of the stages of pregnancy, what is pregnancy, how many weeks it is, all the different trimesters, the physiological changes that your body goes throughout pregnancy, the importance of staying active, the current research and the guidelines, particularly the Australian guidelines, including red flags and things to look out for. The great core debate, which is a personal favourite of mine. So we'll talk about what you should and shouldn't be doing throughout pregnancy, and if you can make things like abdominal separation worse. So we'll have a bit of a discussion about that, and the importance of seeing a women's and pelvic health physiotherapist during your pregnancy. And then we can do some questions at the end. All right, so pregnancy is a total of 40 weeks. Your pregnancy starts from the first day of your last period. So normally when people find out that they're pregnant, they're already 4 weeks pregnant. Your first trimester is from weeks 1 to week 12. Typical symptoms or typical things to expect throughout that phase of your pregnancy: fatigue, nausea, vomiting, dizziness, lightheadedness, increased urination, constipation, and bloating. Obviously, all the kind of typical things that you think about throughout that first trimester. Your second trimester, your energy levels tend to improve. Nausea tends to cease by this point. This is when a lot of your physical changes start beginning, and this is a lot of the time when I see people come into the clinic for back pain, pelvic pain, rib pain, thoracic pain, mid-back pain, all that kind of stuff. And then third trimester, you get, again, more changes. That baby's occupying more space in your pelvis and your abdomen, so shortness of breath, pelvic pressure and heaviness, your fatigue tends to return, pregnancy insomnia starts. So does pregnancy heartburn and reflux, swelling in the hands, ankles, and feet. So all the fun stuff. All right, so the physiological changes that happen during pregnancy, let's start with the hormonal changes. So the main one, or the main hormone that acts on your body throughout pregnancy, is relaxin. Relaxin is the hormone that gets spoken a lot about in regards to pregnancy. What relaxin does is it actually increases your ligamentous laxity. So what that means is it makes your ligaments a little bit more mobile. It can make your joints a little bit more unstable. And then what can happen is a lot of your muscles around your pelvis and your lower back and your groin tend to kind of tighten to try and protect you, and that's when a lot of the pain in your pregnancy can start. It's also the reason why a lot of women throughout their pregnancy who have had a history of hypermobility or previous joint disease. So it's just something to be mindful of with training and whatnot, to make sure that you're not pushing extreme ranges of motion and whatnot if you have a history of hypermobility. Progesterone and estrogen changes and increases. This can cause mood changes, fatigue, but also temperature regulation. So obviously something that we need to keep in mind when exercising and training. Your HCG levels are normally more so responsible for early pregnancy symptoms like nausea, and then prolactin and oxytocin tend to influence your body a little bit more throughout later stages. So preparing the body for lactation and breastfeeding. and bonding postpartum, but they can also impact your mood and your ability to recover. All right, musculoskeletal changes, altered posture. Obviously, with a big belly growing in front of you, it changes your center of gravity. So a lot of girls actually find that they're quite unbalanced throughout pregnancy. They are at increased risk of falls and whatnot because they just kind of don't really understand where their body is in space. What that can also do is change where your pelvis is sitting in space. So what a lot of girls want to do, so throughout their pelvis, they like to anteriorly tilt through their pelvis. So they kind of almost stick their bottom out a little bit to try and counteract the weight change and pressure change and whatnot. That can, again, then cause back pain and hip pain and whatnot. So it's something that I see commonly throughout the clinic. Restricted thoracic rotation, so restriction throughout your mid-back and throughout your rib cage. A lot of the time this happens because as your belly, or as baby grows and as your belly expands, your ribs actually kind of have to move out of the way for baby to come down and come and sit within your belly. As your ribs move out of the way, your muscles that kind of connect onto your rib cage are like, oh, hang on a second, what's going on here? And they kind of tighten as well. So that's what limits you. Under increased load, there's a lot more pressure sitting through it as baby is sitting on your pelvic floor. That can, because your pelvic floor is sitting in a lengthened position, that can actually reduce your pelvic floor strength. It increases the stretchiness, but that also can increase your risk of pelvic floor issues like incontinence and prolapse. However, we know that because your pelvic floor is nice and long, it's a great thing for childbirth and for vaginal birth. So it's really tricky because we do want to see that pelvic floor lengthen, but we also don't want to see those symptoms come about. And that's where kind of women's health physiotherapy is important, to find that balance between the two. And abdominal wall stretching. So abdominal separation is a given throughout pregnancy. It's normal, it's common. You cannot control it throughout pregnancy. We're going to talk a little bit about that later on throughout the webinar. But just know that it is normal throughout pregnancy. Cardiovascular, so normal for you to have increased blood volume. That will increase a pregnant person's increased resting heart rate, and that will also reduce her aerobic capacity and increase her chance of overheating as well. So definitely things to keep in mind when exercising. The risk of supine hypertensive syndrome. So basically what that is that's when pregnant women are lying flat on their back. What that does is that can actually block the inferior vena cava, so where all the blood flows into your heart. What that can do is that can make women, their blood pressure drop. They'll feel quite dizzy, but it can also make bub quite distressed. So it's not ideal. We're going to talk a little bit more about the guidelines of when you should and shouldn't be lying flat on your back a little bit later. Respiratory, decreased lung capacity due to diaphragm elevation, just from baby kind of occupying that space, and then therefore that will increase shortness of breath.
Can I just jump in quickly? Sorry, can I just jump in quickly then as well? With the pelvic floor work, how often would you be seeing someone in that trimester? Would it be a weekly thing or a fortnightly thing, or are you just influencing what they're doing at that point in time?
Yeah, so normally I catch up with women throughout their pregnancy. If they're having issues anywhere from 12 weeks, I can check their pelvic floor. But normally from 20 weeks, I can actually do a proper vaginal exam. The only reason why is they have like a 20-week scan, and that kind of tells me where their placenta is sitting and that their cervix is long and closed. So I can't really do like a deep vaginal exam until after 20 weeks. So that's when I kind of check things out at 20 weeks. If they're going well, I don't normally see them again until 30 to 34 weeks. I don't normally check women regularly throughout their pregnancy unless they're having issues.
Would you prescribe like a little bit of homework for them to do that?
Yeah, they go home with normally a strength program. With their pelvic floor exercises, they should be doing them 5 times a week. So I say to girls, aim for every day because you'll probably miss a couple of days. But yeah, we're going to kind of touch on that a little bit more in a sec, because the pelvic floor exercises are important, but you just got to make sure that you're doing them right.
Fantastic. Cool.
Yeah. All right. Well, let's go back. So why is exercise important? We all know that exercise is important, but why is it important during pregnancy per se? Obviously, it supports physical health, reduces your pregnancy prior to pregnancy. They stop exercising in their first trimester because they're sick and they're nauseous, and then they never get back into it because of the fatigue. They're the girls that really struggle because their body is so used to moving. So definitely important to stay active throughout your pregnancy. It does reduce your risk of pregnancy complications like preeclampsia. Now, preeclampsia is actually a medical emergency, and it is really dangerous for mother and baby. What it is it's an increase of blood pressure, and you also get like an increased protein in your urine. It can cause like premature labor and birth and whatnot. So it's definitely nothing that we want. And we know that the research says that exercise reduces your risk of developing preeclampsia, and also gestational diabetes, which can also cause complications for birth and for baby. Supports mental and emotional health, prepares the body for labor and delivery. So obviously, the way I describe labor to women is, especially for a vaginal birth, it's like a marathon. You just don't know when it starts and you don't know when it ends, and you want to be fit. Like, you want to have good endurance, you want to have good strength, because if you don't, you're going to fatigue really quickly and you're going to struggle. And then having an epidural and whatnot and all that kind of stuff. So we want to make sure that we are strengthening through our hips, pelvis, abdominal wall, our pelvic floor as well. And we know that the research says that this does actually lead to a shorter labor duration. So super, super important. Promotes quicker postpartum recovery. Obviously, the stronger you are going into it, the stronger you are coming out of it the other end. And we know that there's actually significant benefits for babies. So healthier birth weight, improved neurodevelopment, heart and metabolic health for bub. All right, so these are the current research guidelines. These are the Australian guidelines. I think that they're pretty vague. During your pregnancy, aim to be active on most, if not all, days of the week. Do moderate intensity activities. So moderate intensity is 50 to 70% of your heart rate max. That is for 2.5 to 5 hours each week, or vigorous intensity, and that is 70 to 85% of your heart rate max for about 1.25 to 2.5 hours each week. So technically it means to do 30 to 60 minutes of moderate intensity activity, or 15 to 30 minutes of vigorous activity on most days. Do muscle strengthening at least 2 days each week. Break up long periods of sitting and standing still, and do your pelvic floor exercises. So this is a grade A recommendation from the International Continence Society. We know that doing your pelvic floor exercises throughout pregnancy reduces your risk of urinary incontinence and fecal incontinence postpartum. It's just important to make sure that you're doing them right, okay? So what is not safe? Obviously, contact sports are not safe. Anything that is increasing your risk of falls, so skiing, horse riding, all that kind of stuff. I get asked about skiing all the time. It's not safe, but people still choose to do it, but that is completely on them. Lying flat on your back after your first trimester. So basically the guidelines around this are kind of all over the place. Like, the global guidelines are a bit all over the place. Australian guidelines are any time from the from the second trimester onwards, you should not be lying flat on your back for any kind of exercise or sleeping or anything like that. The USA, the American guidelines are from 20 weeks. The UK guidelines are from 16 weeks. And the Canadian guidelines are only if you feel lightheaded, you should stop. So I know it seems really conservative, but technically the Australian guidelines are from 13 weeks onwards. You shouldn't really be doing anything on your back.
And sorry, to be transparent on that as well, we really want to encourage people that they're not lying on their back anyway, right?
Yeah,
we want to be pushing that they're standing up, moving around, doing normal things. Cool.
Yeah, exactly. The hardest part is sleeping. Like, girls wake up on their back and they get really terrified that something's happening.
Absolutely.
To be fair, most of the time your body's going to tell you if it doesn't like it anyway, but realistically, yes, for like girls that are doing Pilates and stuff, for them to do like a normal Pilates class, because a lot of Pilates is supine work. So then they have to try and find themselves a pregnancy Pilates class, which can be tricky. All right.
Gotcha.
Avoiding physical activities at high altitude. So I know some of those high altitude training gyms are quite common. Not okay during pregnancy. Overheating and dehydration, obviously it's a bit of a given. And swimming in pools greater than 33 degrees. So we know that can just increase your body temperature, which is not ideal for baby. Now, what is safe? Recent research has said that training up to 85% of your heart rate maximum is completely safe for mum and bub. Obviously, if you were training up to 85% of your heart rate max prior to pregnancy, high intensity resistance exercise during pregnancy is safe and well tolerated by both mum and fetus. Pelvic floor strength training, definitely safe, definitely advised. I've kind of touched on it twice already. The important thing about your pelvic floor, especially with first-time pregnancies, is that girls that have never had a baby before normally have a really strong pelvic floor. Normally they actually have an overactive pelvic floor. So sometimes with the strength training, the focus is more so on the relaxation phase or the eccentric phase of the movement rather than the actual concentric phase of the movement. So that's why I always say to girls, make sure you see a women's health physio to make sure that you are doing it properly and you are actually physically relaxing after each contraction, because that is really important, especially for girls that want to have a vaginal birth. We need to know that your pelvic floor can relax. Does that kind of answer your question from before, Lockie, about the pelvic floor stuff?
Absolutely.
Yeah. Okay, cool. Deep abdominal activation, we know that it is safe to do during pregnancy and it is encouraged. A lot of my patients during their first pregnancy, their activation throughout their deep abdominal wall is pretty good. Second pregnancy, normally not so good. So we want to make sure that you are activating through your deeper abdominals whenever you're lifting, whenever you're doing any kind of Pilates movement, all the time. So what I normally do with girls is I get them in the clinic. I have a real-time ultrasound machine. They actually can see their abdominals on the screen, and I get them to do certain movements, and I just make sure that they are turning on their abdominals properly. And then I kind of reteach them how to brace so that they're not over bracing or they're not kind of bearing down through their pelvic floor, or yeah, they are turning on properly. So that's important as well. Red flags and other considerations. Obviously, a big one, make sure they have medical clearance from their doctor or midwife. There are some conditions that require individual advice. So things like incompetent cervix, preterm labor, persistent bleeding, placenta previa where the placenta is low-lying, preeclampsia, which was the high blood pressure that we touched on before, and intrauterine growth restrictions, so a small baby, and then multiple gestation, so triplets or higher. Common warning signs would be chest pain, shortness of breath, severe headaches, regular painful uterine contractions, vaginal bleeding, and persistent dizziness. All right, the great core debate. The research constantly shifts around what we should be doing during pregnancy, what should we be doing postpartum. It just constantly keeps changing. So back in the day, we used to do heaps and heaps of crunches, and then we took them away and got rid of them. And we found, or we said that they are definitely not safe. The research is then shifting again and doing another 180. So basically during pregnancy, I always tell girls, you are not making your ab separation worse by doing anything that you do. Even if you sit yourself up out of bed, even if you did 100 crunches, we know that it's actually not making your ab separation worse. What it can do is it can cause discomfort through your abdominal wall. It can slightly increase your risk of developing an umbilical hernia. So basically what happens during pregnancy is you've got your rectus abdominis, or your kind of six-pack muscles that sit through the center of your abdomen. During pregnancy, your abdominal muscles separate, okay? They're not floating in space. You have something called the linea alba that's connecting everything together. It's just that that linea alba has been stretched, okay? When you do a crunch or a sit-up or something like that, sometimes people notice that they're doming, so they get pressure coming through their linea alba. what can happen if that linear alba is quite thin is there's constant pressure coming through there. You can actually get a bit of a break or a tear in that wall, and that's what we call a hernia. Okay, so still not safe to be doing these kinds of things, but just know that it's not actually physically making your abdominal separation worse. It's just not ideal. We know that abdominal separation is more so linked to genetic history. So if your mum had a lot of abdominal separation, it's linked to baby size. So obviously bigger babies, bigger abdominal separation, and your anatomy. So those short girls with really short torso, they're the ones that tend to get a lot of abdominal separation. They're the ones that tend to have bigger bellies, the basketball kind of looking belly. They're the ones that get more abdominal separation. Okay. Now, during pregnancy, deep abdominal work is safe to do, and it's actually beneficial because it functionally makes you stronger. It doesn't reduce your risk of abdominal separation, and it doesn't improve the ability for everything to come back together. It just functionally makes you stronger. That's it. The other thing that you can do for your abdominal separation that the research actually has found is that compressing your abdominal wall as much as possible in the first 6 to 8 weeks postpartum and strengthening after that is really the only thing that you can do to help abdominal separation. You can't do anything about it during pregnancy. So I tend to tell girls, just try not to overthink it. Try not to overthink it when you're training. If you are getting a little bit of doming, then I get girls in to try and teach them how to control the doming to reduce the risk of umbilical hernias. But yeah, I try to tell girls not to overthink what they're doing core-wise and just make sure that they're activating through their transverse abdominis as they're training. There was a new research study that came out, I think it was about 6 months ago actually, and they were investigating doing crunches or rectus abdominis work during pregnancy, and the study size was way too small, and it's definitely not anything that we will be implementing soon. I just thought it was an interesting note that we keep kind of backflipping on this topic. All right, the importance of seeing a women's and pelvic health physio. Obviously, I'm a little bit biased, but I think it's really important to see someone throughout your pregnancy to manage aches and pains, lower back, SIJ, sacroiliac pain, pubic symphysis pain, sciatic pain, rib pain. I see a bit of everything, to be honest with you. It's really important to see them for advice and sizing for compression garments and particularly compression garments postpartum, but pelvic belts. A lot of people buy belts throughout their pregnancy, and a lot of them don't really do anything. Some of them are really good, but it's just kind of nice to know what you should and shouldn't be buying for certain aches and pains. Management of your pelvic floor, obviously improving your strength and coordination to reduce the chance of developing incontinence or pelvic organ prolapse. Labor preparation. Now, labor preparation is something that has been researched significantly over the last 5 to 10 years. And what we've found is that what we do as women's health physios is really beneficial to prepare girls for birth. What we do with women during pregnancy is I actually take a length measure. So you can see me in that picture. I'm taking a length measure of your pelvic floor. So I take length measures of your pelvic floor to make sure you're sitting where you should be sitting at that point in your pregnancy. I teach you something called perineal massage, which reduces the risk of tearing throughout birth. And then I teach girls how to push. Now, a lot of girls have no idea how to push a baby out, and it can be really daunting when they're in there to be told to push, and they're not really sure where to push from. So I actually teach girls how to push properly, appropriately, and efficiently so that when they get in there, they know exactly where to push from. And even if they did have an epidural, super passionate about preparing girls for vaginal births. And we know from the research that it is making a really big difference in birth outcomes. It also makes people feel really empowered and knowledgeable going into their birth, which can make them make good birth choices. And abdominal separation, managing abdominal separation throughout pregnancy, giving women specific guidelines throughout pregnancy, and making sure that they are turning on that transverse abdominis properly throughout pregnancy. And that's it from me for pregnancy. I could talk about this for days, but I tried to kind of keep it limited. But yeah, any questions?
Can I jump in and ask about post-pregnancy? So people that you see pre-birth, do you have them booked in to see you after as well? Or how does that sort of work?
Yeah. So they normally come and see me for a 6-week postpartum check. For my girls that I kind of flag through pregnancy that have like a larger abdominal separation or their belly is quite big, I actually get those girls in a little bit earlier. So I get them in at 4 weeks and we start strength training. We start kind of baby crunches, rectus abdominis work throughout that early period of time. However, but otherwise I can't technically do an internal examination on girls until 6 weeks.
Okay, and breastfeeding. So I see quite often, because the female is holding baby off to the left or to the right or whatever's happening, there's got to be a lot of posture imbalance there. How do you sort of juggle that and handle that?
Yeah, I mean, the hardest thing is that a lot of the time, yes, it's mobility related and women are just kind of keeping themselves in terrible positions. It is postural advice, making sure that they're feeding in like proper feeding chairs and not on the lounge and not like in bed as much as possible. Girls always feed on the lounge and they're like, it's just so comfy. And I'm like, yeah, I get it, but it's terrible for your back, and using a pillow and all that kind of stuff. I normally at their 6-week check give them a lot of mobility, and then after that point, if they're still really sore, I give them a strength program to start doing, or I just really encourage them to try and get back into exercise, get moving, all that kind of stuff.
Okay, cool. So it's like someone, if they get an injury or they have a niggle, they tend to do less.
Yes.
Much like with pregnancy as well. When you feel like you should be doing less, it's actually probably a good avenue to attack, to do a little bit more within reason.
Yeah. I think the biggest thing throughout pregnancy and postpartum, well, particularly postpartum, people just say they don't have time, which I get it. It's a massive life shift change and it's tricky and you're navigating so many different things. But I just say to girls, even when you're standing there, just like twist through your mid back, because like if you do 1,000 of those a day, it's going to be better than trying to do 10 cat-cows or 10 thread the needles on the floor. Just try and move your body as much as you can throughout the day. So yeah, it's just trying to find little bits of advice like that to give them without bombarding them with like a million things. If you give a postpartum mum 10 things on her list to do, she'll be like, I can't do that. I'm not doing that.
Correct. And it's just like little things like that, just swinging around, making it habitual, making an unconscious effort over time that will stick for sure.
Yeah, exactly. Cool. Right.
Okay, that's all the questions I had answered.
Cool. Awesome.
Really, really knowledgeable. I think the biggest punch home point and what I've learned the most as well is that females will need to establish how to train pre-pregnancy and understand, much like food, lifestyle training, learn all these things, fundamentally keep it up, but pull back the intensity a little bit as you get through the trimesters.
Yeah.
Prepare for birth, being a professional.
Yeah.
What's that?
I think there's a lot of fear throughout pregnancy that they're going to do something to baby and it's not safe and whatnot. So I think the fear is a big thing. So trying to reduce that fear to say, no, it is actually safe. As long as you're not pushing the boundaries too much, you can be training pretty much up to 85% of your heart rate max. So yeah, it is safe.
And lying on our back for the most part, pregnant or not, shouldn't be advised. Hey.
Exactly right.
All right. Well, thank you so much. That was really, really awesome. And I think everyone's going to get a lot of knowledge out of that one. I know I did.
Awesome. Thank you.